Good morning, everyone, and good morning, the viewers at home. Yes, we are missing a lot of children, especially during the pandemic. In South Africa, we have several number of children we are missing, but that we do have, as a department, we do have the strategies to make sure that we catch up on all those children who we have missed, especially during the hard lockdowns.
Do we have an idea of the numbers? I mean, globally, we're talking about 20 million. Are we talking about hundreds of thousands? Are we talking about millions here in South Africa?
In South Africa, for last year, we only missed 248,000 children, not millions, because anyway, we don't have millions of children.
Okay, take us through some of the vaccinations that we currently carry out here in South Africa.
The vaccination program in South Africa is carried out in two sectors, the private sector and the public sector. So in the public sector, all the vaccines are free of charge. And in the private sector, some of the vaccines may be free of charge depending on the agreement between the specific province or district with the private sector. But some of them, like your chicken pox, which are not within the expanded program on immunization schedule, the parents may have to pay for them.
Now, do you foresee COVID-19 vaccines becoming as common as regular vaccines in the near future?
Yes, as long as we are still having the disease is not yet eradicated, and because we already have the vaccine, so it will still be continue to having a COVID vaccination. Because if you can look at even other diseases, for instance, I can give you an example of smallpox. It was a disease which was affecting millions of people, and after the introduction of the vaccine, then that disease has been eradicated. And even now in the African continent, last year we have eradicated polio, wild polio disease, because we didn't have the cases of the wild polio diseases in Africa for the past 3 years.
Now, we know that this week aims to promote the use of vaccines to protect the people of all ages against the disease. What initiatives are you carrying out as part of this process?
We do have, as I said that earlier on, that we do have the catch-up strategies. Last year, we have embarked on intensifying the catch-up drive, where we are looking for children who have missed vaccinations, the eligible vaccination, as we are saying that the COVID pandemic has also disrupted many of our services in the health sector. So we are making sure that all those children are being catch up. So it has been going on since last year, and some provinces have started it even earlier, somewhere around June last year, after we have seen the decline in the coverage of vaccination in children. And from November last year, we intensified it until this year. We are still going on intensifying it. And with the World Vaccination Week, it has even given us more opportunity to make sure that communities are made aware to bring their children or themselves to the facilities to get vaccinations.
Now, in light of COVID-19 and obviously families, parents unable to go out there as much as they could, are you looking at initiatives as part of your intensifying the program of taking mobile vaccination centers to the people?
Yes, because the vaccination we are not only doing it in the facility for us to make sure that we reach all the people with vaccination. We make sure that we do have the outreach services. The outreach service can be a mobile clinic or can be a setting outside the health facility where maybe it can be used school or crèche or wall where people will go there to be vaccinated.
Now, we talked about 248,000 children having missed vaccination last year. What is the likely impact of this many children missing their vaccination?
The impact will be obvious, the vaccine preventable diseases outbreak. So we may have the outbreak of diseases if we are not able to catch up on these children. And for us to be able to catch up these children, remember the health system, we are ready. So we have also to make sure that even our demand side, which are communities, they are willing to come and take the vaccinations. So if we don't vaccinate these children, then we are going to have an outbreak of diseases. And one of the quickest outbreak, which is the sensitive disease, is measles. So measles is very infectious and is very contagious, because if one child can catch measles virus, then that one child can infect other 20 children at a time.
Okay, so what exactly are you doing to ensure that this happens? Obviously, 248,000 is a lot. Do you have timelines? At what point would you have come down from the 248,000 to more acceptable numbers?
Yes, as I said that those were the numbers for last year. So and I said that we are busy with the catch-up campaign now. So we are doing the catch-up, and there are mobiles, there are outreach services going to the people to make sure that the children are being vaccinated, and we are having the social. Right now is also one of the demand creation to make sure that people are getting vaccinations.
Elizabeth, thank you for speaking to us. Certainly wish you well in catching up on that huge number of 248,000. Manager for the Immunization Programme, the National Department of Health, Elizabeth Maseti.